Imagine you or one of your loved ones lying in a hospital bed and your nurse coming into your room, out of breath, apologizing for not seeing her for the last 2 hours because she's juggling 4 other patients, critical patients, and just got hit with a new admission. Imagine how many errors were made during this time, symptoms missed, and medications and treatments that were delayed. Think about it. This isn't just a made up story. This is reality, and it's happening to patients and nurses every single day. As a nurse, I have witnessed and lived these events firsthand. In my 10-year career, not only have I witnessed how unsafe nurse to patient ratios negatively affect patient and nurses, but I've also felt the burnout and the symptoms that go along with it. I have actually stepped away from bedside nursing for a while to get rid of that heavy feeling and tend to my mental and emotional needs that were hindered by the burnout. Implementing safer nurse to patient ratios is essential for improving patient outcomes, reducing nurse burnout, and ensuring long-term cost effectiveness in healthcare. This requires immediate action through policy and law change and public advocacy. Studies show patients in understaffed units are more likely to suffer from preventable complications, such as infections or medication errors. For every additional patient assigned to a nurse, the risk of mortality increases by 7%. 7%. Take that in for a minute. You're in a room of 100 people, and 7 out of that room may die. What if it was you? Or what if it's one of your 10 family members that's also in that room with you? Maintaining safer nurse-to-patient ratios is crucial for reducing nurse burnout and improving job satisfaction. When nurses are assigned to fewer patients, they experience less stress and fatigue, which leads to better mental and physical health, which in turn leads to less turnover and more experienced nurses at the bedside. While hiring more nurses might seem like an increased upfront cost, studies actually show that it is ultimately cost-effective for healthcare systems in the long run. Studies from the National Library of Medicine found that higher nurse workloads are associated with mortality, length of stays for patients, and higher cost outcomes for hospitals. One particular study found if nurses on medical surgical units cared for no more than 4 patients each, thousands of deaths could be avoided, and patients would experience shorter length of stays, which results in cost savings, huge cost savings for hospitals. The solution is clear. We need the legislative to mandate safe nurse-to-patient ratios. It's not rocket science, and it isn't an unattainable dream. In fact, one state has already figured it out and has been doing it for years. California. California is the only state to enforce nurse-to-patient ratios and have seen significant improvements in patient outcomes and reduced nurse burnout. That alone is huge. The National Nurse United discussed a research project on their website done by one of the country's foremost nursing researcher, Director Linda Eileen, PhD, RN of the Center for Health Outcomes and Policy Research at the University of Pennsylvania School of Nursing. When comparing California to other states' ratios, her study concluded that fewer patient assignments meant fewer California RNs missed changes in patient conditions. Because of their workload, it ultimately translated into fewer patient deaths. And since the staffing ratios was enforced in 2004, California staffing has had a positive change in staffing, and today, almost 15 years later, California has the best nursing staffed hospitals in the country. The state has seen steeper declines in mortality and improvements in other indicators compared to other states. They have built the model for us, and the research is done. It's showing that it works. The following chart that I'm going to show you shows their enforced ratios and how they do it. As you can see, it's broken down by specialty, Pay close attention to the medical surgical. 1 to 5. 1 to 5 could change healthcare. It could be detrimental for healthcare. This is doable and would be an absolute game changer for nursing and for patients. Imagine walking into a hospital where nurses have the time to listen to their patients, respond promptly to emergencies, and provide compassionate care, where preventable deaths are minimized and nurses leave their shifts feeling fulfilled and not defeated. Or we cannot do anything about it and have a healthcare system where errors rise, turnover worsens due to burnout, and patients suffer simply because we failed to make a change. What future do you want to see? What can you do right now to help make this dream a reality? You can do something as simple as sign a petition urging to pass laws to safer ratios. You can simply go to www.change.org, look up this specific petition, and it takes 5 seconds to sign. You can call or write to our state legislator, asking them for safer staffing laws. You can do one or both of these. And spread the word to family and friends. Think about it for a second. If you just picked one of those options and chose three friends to educate and advocate for safe ratios, imagine if those 3 friends went and told 3 more, and so on. It could make extraordinary leaps towards the fight for safer nurse to patient ratios. In conclusion, the evidence is clear. Safer nurse to patient ratios are not just a matter of fairness for healthcare workers, but a critical factor in improving patient outcomes, reducing nurse burnout, and being cost effective in the long run. Thank you.